everyone, I'm Leslyn Keith. Thanks for joining me as I talk about the ketogenic solution for lymphatic and fat disorders. I'm an occupational therapist and I've been treating lymphatic and fat disorders for over 20 years. I received a clinical doctorate in occupational therapy with a focus on lymphedema and obesity in 2015, and I have integrated nutrition into my clinical practice ever since. I have two disclosures. I sell the program Lymphatic Lifestyle Solutions. This is a complete kit for lymphatic professionals interested in providing a lifestyle change program that promotes a ketogenic diet for clients in a group setting. I've also written the book, The Ketogenic Solution for Lymphatic Disorders. I'd like to talk to you about a relatively ignored body system, the lymphatic system. This is an extensive network of vessels, lymph nodes, and lymphoid organs, such as the spleen and thymus gland, that is highly important to health. One of its primary functions is fluid balance. As a matter of fact, with the revision to Starling's equilibrium in 2010, the lymphatic system is of supreme importance for fluid balance, since we now understand that the fluid and nutrients brought to the tissues by the arterial system is almost exclusively evacuated by the lymphatic system rather than reabsorbed into the venous system as we thought. Our lymphatic system is highly involved in immune functions by producing immune cells and transporting them to where they are needed, and also by filtering out and killing pathogens using the lymph nodes and other lymphoid organs. Our lymphatic system removes waste, such as damaged or dead cells, and toxins by transporting them to where they can be expelled from the body. Lastly, almost all dietary fat is transported from the intestines to the blood via the lymphatic system. Our lymphatics are also responsible for reverse cholesterol transport or the delivery of excess HDL from the tissues back to the blood. When these functions are disrupted, a condition called lymphedema can develop. Lymphedema is the abnormal accumulation of protein-rich fluid in tissues that can cause chronic inflammation and reactive fibrosis in the affected areas. The most common cause of lymphedema worldwide is a parasitic infection called filariasis. Lymphedema can result from cancer treatment when lymph nodes are removed or with radiation therapy. A more rare form of lymphedema is due to genetic mutations that result in lymphatic impairment, and then quickly becoming the most common cause of lymphedema is obesity. Another condition that is classified as both a lymphatic and a fat disorder is lipedema. Lipedema is a condition that occurs almost exclusively in women. There is a disproportionate deposition of fat to the lower half of the body, often severe hypersensitivity and pain to the lower body, easy bruising, a cuff of tissue just above the ankles, and end of the day swelling and water retention that can progress to lymphedema. And interestingly, lipedema is widely believed to be resistant to diet. A woman with lipedema quickly learns that if she goes on a traditional weight loss diet that's low calorie and low fat, she will only lose weight in her upper body, which further accentuates the disproportion between her upper and lower body. Theories about the causes of lipedema include a hormonal imbalance, since the onset usually coincides with hormonal events such as puberty, pregnancy, and menopause. Several potential genetic mutations have been identified as probably that links those familial connections that make us think that there might be a genetic mutation. Evolutionary adaptation has been suggested due to the advantage of storing energy in metabolically safe areas of the body during famine and living to reproduce and care for the young. Most recently, the idea that lipedema may be a metabolic disorder brought on by diet is being discussed. Lymphedema and lipedema are the most commonly treated lymphatic and fat disorders seen and are treated comparably with complete decongestive therapy, which is depicted in this image with interlocking phases of treatment. The intensive phase on the left includes daily treatments of manual lymph drainage, compression, skin care, and exercise that is then transitioned to a maintenance phase of self-care shown on the right. Lymphedema and lipedema are both chronic conditions that require regular follow-up visits with a trained professional to help manage them and to maintain health. Early in my career, I noticed that more and more of my patients had a comorbidity of obesity. This pie chart shows how a group of my patients who were seen over a period of 6 months fell according to BMI. Over 75% were overweight or obese. Even more astonishing was that almost 1/4 of my patients during that time were morbidly obese. This increase in obese patients being treated for lymphedema was being commonly observed in clinics everywhere and seemed to be at an even higher rate than the incidence of obesity in the general population. Many articles and studies began to appear noting that not only that higher BMI was associated with increased risk of developing lymphedema, but also that higher weight made existing lymphedema worse. Several studies showed that weight loss was also associated with decreased lymphedema, and this was achieved always by a low-calorie, low-fat diet or with exercise. Because the evidence of that a ketogenic diet was the most effective intervention for weight loss was mounting, I decided to complete a pilot study that encouraged a ketogenic diet with patients who were diagnosed with lymphedema and obesity. The article about my study was published here in the American Journal of Lifestyle Medicine in 2017. There were 10 participants who completed my 3-month study. 6 participants chose to adopt a ketogenic diet, while the 4 remaining participants did not. The red line on the top of this chart depicts the group that did not use keto, while the group that did adopt a ketogenic diet is depicted in blue. You can see that the group that used the diet started out with a much lower mean weight than the non-keto group. Weights were measured over 5 sessions. The first 3 sessions were prior to the intervention and show a very stable baseline in both groups. The 4th measure was after the intervention, and then the last measure was 30 days later. The group that did not adopt a ketogenic diet was able to lose an average of just over 1 pound, or less than 1 kilogram, over the course of the study. The group that used a ketogenic diet, however, was able to lose a mean of 18 pounds, or just over 8 kilograms. This was an 8.1% reduction of baseline weight, which we know has positive health implications. In fact, the group that adopted a ketogenic diet outperformed the group that did not in all 10 outcome measures, including weight, percent body fat, limb volume, quality of life, and activities of daily living performance. Although we learned a lot with the study, an interesting thing happened in my practice. Patients who did not have weight to lose were adopting a ketogenic diet, and they were showing reduced limb size with just this dietary change. This woman showed less swelling in her leg after just 45 days of using a ketogenic diet. I started to believe that the reduction of lymphedema was not just a weight loss. It certainly seemed like this way of eating supported improved lymphatic function. This certainly was the case for Kelly as well. Although from looking at him, you may think he was obese, as he was diagnosed with obesity by all of his doctors. In actuality, he had a great deal of swelling due to a treatment for reflux that ended up putting polymer into a major lymphatic vessel, which then allowed it to infiltrate throughout most of the rest of his body. He gradually gained a great deal of weight due to swelling in his legs, arms, trunk, and the right side of his face and neck. He developed difficulty breathing and had to use a CPAP and was put on oxygen. He suffered a great deal of pain and had severe digestive symptoms. He was becoming so ill and debilitated and even lacked a proper diagnosis that he even considered suicide. But because his doctors considered him to be obese, he was told to eat a low-fat, low-calorie diet and to exercise more. Several years later, when it was discovered that he actually had lymphedema due to the reflux procedure, this was still the recommendation for treatment. When Kelly found that he actually felt better after a particularly fatty meal, he began researching a ketogenic diet. He started this eating plan in 2017. By 2019, he was a new man. By his 87-pound weight loss was only part of the story. His breathing improved so much that he was able to discontinue his CPAP. He experienced increased energy and vitality. He had improved cognition, improved bowel function, a moderate decrease in pain, and of course, decreased swelling. He continues to carefully manage his condition, but after 12 years without proper treatment, Keto gave him back his life. The simple reason that keto seems to benefit lymphedema, even in the absence of obesity, may be that carbs are inflammatory to the lymphatic system. Pictured here is the inside of lymphatic vessels in a study that was examining the impact of metabolic syndrome on lymphatics. The researchers induced metabolic syndrome in rats by feeding them a high fructose diet. The pictures on the left show the inside of a lymph vessel on normal rat chow. The right-hand pictures, however, show a great deal of inflammation in the vessels of the rats fed a high fructose diet. They found that the vessels were so inflamed that transport capacity was reduced by as much as 50%. Research has also demonstrated that carbohydrates damage the glycocalyx in both blood and lymph vessels, which leads to leakiness in those vessels, as well as water retention and subsequent reduced transport capacity. This, unfortunately, all leads to swelling. This is a really interesting study that was reported in 2019, examining the impact of weight loss from diet and exercise in women who had lymphedema related to their breast cancer treatment. The study had some unexpected results. This was a randomized controlled trial with 4 groups. All 4 groups were given a compression sleeve for their arm with lymphedema. While the control group only had the compression sleeve, the second group also participated in an exercise program. The third group used a commercial weight loss program, and the last group did both. They had the sleeve and the weight loss program, and they did exercise. Interestingly, both weight loss groups actually did lose weight, but surprisingly, unlike all previous studies, there was no corresponding reduction in arm swelling associated with the weight loss. I suggest to you that this was because the meal replacement used was so high in fructose and maltodextrin that inflammation reduced lymphatic transport capacity and swelling could not reduce. Several studies have shown that fatty acid oxidation and ketones support lymph vessel growth. The pictures from this animal study show the control group on the left with normal lymph vessel proliferation pictured in green. The second picture shows marked decrease in lymph vessels when an agent that blocks fatty acid oxidation was administered. The third picture shows recovery of lymph vessels when ketone supplementation in the form of acetoacetate was provided. The last picture on the right shows that when given both the agent that blocks fatty acid oxidation and the acetoacetate simultaneously, lymph vessels were able to form using the ketones. This animal study may offer an explanation why lymph vessels are able to form with ketone supplements. It demonstrated that lymphatic endothelial cells, which will preferentially use ketone bodies in the presence of glucose. This research group is now engaged in a study using a ketogenic diet with people who have lymphedema to test this theory on humans. The preliminary results were presented at our virtual symposium last September, and they were very promising and demonstrate the effectiveness of a ketogenic diet for managing lymphedema. With regard to lipedema, this small study was conducted in Norway and conducted in 2019. It is the first to examine the impact of a ketogenic diet on lipedema. 9 women were diagnosed with lipedema, participated in the study that consisted of 7 weeks of a ketogenic diet, followed by 6 weeks of a standard high-carb Norwegian fare. Once again, the results were very promising, and they mimicked what we at Lipedema Simplified have observed anecdotally with over 10,000 women with lipedema on our Keto Way of Eating for Lipedema Facebook group. Weight decreased 9.5 pounds or 4.3 kilograms after the ketogenic diet, and the weight loss was maintained after the Nordic diet. HIP measures reduced after keto, but did not further reduce after the Nordic diet. Triglycerides decreased after keto, but increased again after eating high carb. Pain decreased significantly after keto, but returned to previous levels after the Nordic fare, despite the maintenance of the weight loss. This was an interesting finding because it was previously believed that pain decrease was correlated with weight loss in women with lipedema. This now leads us to believe that the inflammation from carbs are a major contributor to pain and hypersensitivity rather than the excess body fat. This is a patient of mine, Georgia. She is diagnosed with depression and has the classic symptoms of lipedema. She had a gradual weight gain, mostly in her lower body, and complained of severe chronic pain and fatigue, as well as brain fog. The substantial cuffs above her ankles are disguised by her pants. She really felt like she was ready for a wheelchair. She had tried and was successful with keto before and came to me in 2017, ready to stick to it again. Although she was pleased with the almost 50-pound weight loss, she was overjoyed at the other benefits that happened over the next 2 years. Her pain, which was a steady 8 out of 10, completely resolved. Her energy level improved so much that she was able to return to activities that she loved, and her brain fog lifted. Despite these wonderful changes, her vegetarian doctor was concerned that eating a predominantly animal-sourced version of keto would damage her health, so he ordered blood work, which all came back excellent. Her triglycerides were low, HDL was moderate, and best of all, her coronary artery calcium score is 0, which is exceptional for somebody in her 70s. Needless to say, her doctor is convinced that her new lifestyle is one that is best for her condition. I have provided you here with some resources, which include my website, where I sell my book and program, and the website for Lipedema Simplified. You can subscribe to my YouTube channel, and here's a link for the recordings that were from our virtual symposium on keto for lymphatic and fat disorders that was held last fall. And lastly, feel free to contact me at either one of these emails. Thank you very much for your time and attention.